Hello, everyone, and welcome to CSPC 2021. I'm Jenna Hutchen, and today I'm interviewing Shaarika Sarasija, the winner of CSPC's Youth Award. Shaarika, thank you for joining us.
Hi, nice to be here. Thank you, Jenna.
Of course. Now, can you tell me a little bit about your current work as a postdoctoral researcher at the University of Ottawa and the kinds of work you did to get you into that position?
So I've been doing Alzheimer's disease research since 2011 when I joined Dr. Ken Norman's lab at the Albany Medical College to start my PhD. And I worked Alzheimer's disease is something that people have known about for over 100 years. However, there's no consensus on what causes the disease, or, if there's no availability of actual therapeutic agents. All we can do is kind of treat the symptoms. And again, that's because we don't know exactly what causes the disease. So my work was basically trying to understand that and pursuing a path kind of slightly different from the mainstream approach to Alzheimer's disease, which is to kind of get rid of these protein tangles and plaques called amyloid plaques. So my path was a little different from that, and I worked with C. elegans, which are these tiny microscopic worms. And then when I finished my PhD, I wanted to work on a project where, it was a mammalian system. So I wanted to switch into mice. And I joined Dr. Stephen Ferguson's lab here at University of Ottawa. He's in the Faculty of Medicine. So the lab focuses on these receptors called metabotopic glutamate receptors. And right before I joined the lab, they had published this very interesting paper that showed that, suppressing or inhibiting the function of subtype of these receptors helps improve condition like cognitive function in Alzheimer's disease male mice, but not in female mice. So it shows that, there's like a sex-specific difference. And this is incredibly critical to address because women actually are almost twice as susceptible to get Alzheimer's disease as men. And therefore, drug trials and things need to be kind of structured around that. So my goal is to try and understand this more. So the project thus far has been worked on by Dr. Khalid Abdul Rahman, who's the senior postdoc in the lab. So I'm kind of working with him and continuing on this work. So I just got a CHR fellowship for doing this and exploring more about the sex-specific differences in Alzheimer's disease. Particularly with a focus on things like calcium signaling, mitochondrial dysfunction, oxidative stress, and things like that.
Oh, that's such a wonderful project. And it sounds so interesting to hear about your pathway coming from C. elegans into now human systems, and a very applied, socially aware project.
Yes, I think that's something I really like about it. I feel like it does make a societal impact. Like it's very easy as scientists to become very focused on our project and on, that one protein that we study. But I like to think about it on a more, societal scale and a global scale.
Yeah, and related to that, your winning proposal was looking at supporting people living with dementia by incentivizing healthcare professional students to step up and provide respite care to those individuals and their care workers. Can you tell me a little bit about that project and what inspired you to pursue it?
So it was kind of serendipitous that I even discovered that there was such a policy award and I could apply for it. And it's actually the last year I can do because I turn 35 next year. So this is literally the last year I could do it. And then I saw that there was a proposal, I was thinking about it, and something that was kind of nagging me at the back of my mind was the fact that I'd recently started, earlier this year in summer, I had started volunteering with the Dementia Society for Ottawa and Renfrew County, which is a great, society that has a lot of programs to support people living with dementia and their families. And one of the programs that they have is called Make a Connection, Take a Break. So it's a program that allows people like me, volunteers, to go and, when there's no pandemic, go and spend time with people living with dementia maybe 1 hour a week, 2 hours a week, like spend time with them, and thus allowing for the primary caregivers to take a break. So it's basically providing respite care. And when I started doing that, it's very rewarding. I love doing that. Like I love my match. But at the same time, I realized, and especially now during the pandemic, I'm only able to do like Zoom calls or like video calls or phone calls with him. So I realized that even though I want to do this and put in more of an effort, like the most I can do is like an hour or two in there. And the person as well as their caregivers need so much more. My match, like he's a person living with dementia, and he benefits so much from just having a social interaction with somebody outside of his immediate family, right? And especially in the pandemic. And the when I started looking into the impact on the primary caregivers, something I found out was that a lot of the primary caregivers end up reporting that they experience more stress, anxiety, depression. All of those are substantially higher than, for primary caregivers of seniors who are not suffering from dementia. So this means that there definitely is a societal need for us to kind of step up and do something about it. So that's kind of where I got the idea for the project. And I did my undergrad, I did my PhD in a medical college, and now I'm at another medical college doing my postdoc. And one thing I do know is that a lot of med students, PA students, nursing students, all of these guys, pharmacists, they all tend to do a lot of volunteering work, especially before they start their college and even during their college years. So and a lot of them do already tend to work in like a hospital or long-term care facility. So I thought that, hey, maybe if we kind of bring this together and have a more structured approach to it, we could use people going into, like kind of incentivize them and, make them help out and become respite workers. So that's kind of where the idea came from.
Oh, absolutely. It sounds like your proposal is really focusing not just on empowering individuals, but using policy to start creating a structural change. So, can you tell me about why you think it's so important to influence policy and not just practice?
I think you influence policy to down the line, change practices, right? But I think the reason I think there needs to be a change in the policy on how we approach, care for people living with dementia and supporting their primary caregivers is because we need. It's more about having a structured approach because um, there are plenty of organizations that provide support, but it's very much at an organizational level. It depends on where you live in a province. Like if you're in a big city like Ottawa, yes, you might be able to have more support than if you live, in a smaller city outside. So I think for me, it's about kind of putting in those institutional changes, like the provincial government can step up and help out quite a bit in the situation by because so each province has its own set of kind of registered health workers. So there are certain health professions where you have to be registered. You're, under health acts, and each of those are under colleges, which are like kind of self-governing autonomous organizations that do things like licensing, disciplining, and so and advocating for the professionals involved. So it would be interesting for us to be able to go in and kind of work with the provincial government and these colleges to kind of bring together, a structured proposal where we have students who are, already volunteering, already helping out, and have a lot of, medical experience, especially by the time they get into their final year, they have a lot of medical experience. So if we kind of stagger this and go from somebody who's the beginning stages of dementia gets a student coming out of undergrad going into a medical profession versus, somebody who needs more care, like getting somebody who's like higher up, through their education. That way, we can make a significant change in what's happening to the quality of life of people living with dementia.
Hmm. That's such a wonderful goal to have with a proposal. And I'm personally so excited to hear more about it.
Oh,
Um,
thank you.
with applying for an award at somewhere like CSPC, what do you see as some of the biggest benefits of having an organization like the CSPC?
I think for me personally, I come from a pure science background. Like my undergrad was at a pharmacy school, my PhD is at a med school, postdoc is at a med school. It's been very much, science driven. And as scientists, I think we do sometimes struggle to, you know, look past our scientific hubris and like look past, just the science. I think we need to remember that what we do, affects other people. Like what we're doing has an ultimate goal, beyond getting funded and getting papers. And I think CSPC is one of those organizations that for me has been very helpful in that it's been a first step towards, understanding that and realizing that goal that I now have. Like I've been thinking about transitioning from academia and pure science to more policy and policy work. And so for me, it was very useful in terms of understanding, oh, what are the options I have out there? Meeting people, getting involved, and like very much looking forward to the CSPC 2021 conference because it has so many amazing panels, and I'm very excited to learn more about how somebody like me can actually, enact effective change in the community.
Hmm. So, as a young scientist who's starting to dip her toes into the policy world, what would you say to other young professional scientists who are starting to want to influence policy?
I think, at least for me, the first step I did was kind of identify, causes that are really important to me. And what I've done, I've at least started to do is I've identified those causes. So for me, it's things like elder care and dementia care. Those are very important to me because my grandparents were very much my primary caregivers when I was a child, and I'm very close to them. Thankfully, they're in their 90s, they're in good health. But I realized that that's not the case for a lot of people, and I really miss them. So for me, working with the elderly really fulfills me. And so I've been volunteering with, the Dementia Society. I've started volunteering with the Council on Aging in Ottawa. So, doing these kind of things, I'm very passionate about immigration. I'm a new immigrant to Canada. I got my permanent residency just under a year ago. So I'm very passionate about immigration. So I work with a local immigration organization as a career mentor. So I love animals, so I do that volunteering. So I work as a foster parent at times. So I think the important thing to do is to get involved in the community and make those connections with people, like identify where the needs are, identify what works for you, what's going to make you, kind of what enriches your soul, what makes you happy, and, kind of go into that and volunteer and spend time and meet new people. And yeah, that's what I would recommend that we do. And maybe think of things outside our lab work and our, Western blots and mice behavior work. So just, try and do something other than what you do every day and look outwards is what I would say.
Sharika, thank you so much for sharing your insights and your research with us. I'm so excited to follow your career as it progresses more and more. And I very much look forward to speaking to you at the conference this year.
Thank you, Jenna. It was wonderful talking to you. Thank you for the opportunity.
Of course. And formal interview is now over.
Yay!
Lovely. I'm going to stop recording. Hello? Because